Okay, so we are going live. Thank you for tuning in today. We're going to try this again. I'm here today at the headquarters of the National Spine Health Foundation. We're here in Reston, Virginia. The Spine Health Foundation is here to tell Americans about the good news that there are treatments that work. About a third of all Americans suffer from debilitating neck or back pain every year. And that means chances are you or someone you know has struggled this year. And one of the things that we are really excited about doing is telling people the stories of individuals who've overcome their neck or back pain directly from patients who've had such great success. And we call those people spinal champions. Spinal champion is a person who has overcome a neck or back challenge and gotten back to the people and the activities that they love. So I'm joined today by Mr. Ray Pugsley. Ray has been accomplished in so many areas, and he is a true spinal champion. And so without further ado, I am going to let Ray tell us a little bit about his story, and then I'll be asking questions. And anybody out there who wants to pose a question for me to ask Ray, let us know. Send it in the comments there and send us your questions. So Ray, tell us about your story and start from the beginning.
Sure. Well, I guess the biggest reason that I'm a spinal champion is because I've been a runner for many, many years, and I've had to deal with back problems. And fortunately, they've worked out well, such that I've been able to continue what I love. I'm an aging national level runner. So back in my day, I was fortunate to run at the national level at college and post-collegiately, and ran in a couple of Olympic trials. And in 1996, I was at the Olympic trials for the 5,000 meters. And during the Olympic trials, I felt a stabbing feeling in my lower back while I was warming up for the trials. And fortunately, I was able to get through the races and do well and finish sixth, which I was very, very proud of myself with that result. But following that race, which was on a Friday, by Sunday, I was unable to walk straight up. And by the middle of the week, I was walking around hunched over in terrible pain. And that's what brought me to Dr. Schuler at Virginia Spine Institute. And we discussed what had to be done. And it determined that spine surgery was going to be on my agenda as a 27-year-old athlete who was hoping to continue to be an elite athlete for a number of years going into the future.
Were you scared?
I was horrified. I couldn't believe it. 27 years old and all these plans, and I thought, as most people I think do, that back surgery means your life has changed forever and you're not going to be able to continue doing what you're doing. What I actually found out was that through proper treatment, my life was changed forever, and that was to put me back to a position where I could do what I enjoy doing. And after that surgery in 96, I had a laminectomy on my L5, L5S1
And
disc.
tell everybody what a laminectomy is.
Laminectomy is, excuse the layman's terms, but sort of like scoping your knee only around your disc on your back, on between your vertebrae. And once that procedure was done, I was able to get back into things very quickly, and I ran all of my best times in 2 years later in 1998.
So Ray, so you're a Division I collegiate runner. You go to the Olympic trials. You have to have back surgery. You think maybe you're not going to be able to run again. You're afraid. You're horrified. You get better. 2 years later, you have to have another back surgery. You knew that was probably going to be the case. And then after that second procedure, you ran the best times of your life after 2 back surgeries.
Well, actually, I ran best times of my life after that first back surgery.
Okay.
And then I had a more extensive back surgery, spinal fusion, in 2003. And after that, I continued to run at a very high level on events that I hadn't maybe focused on, but I ran my fastest marathon after having spinal fusion.
That's just amazing. I will say also that Ray did win the We've Got Your Back race this past spring. overall winner, age group winner, still running, still competing. And I think, I think one of the things that people don't realize is that you have back surgery and you get back to doing what you want to do. And we talk about the Tiger Woods story this year. He finally gets the fusion and gets out and wins the Masters. And I think, for you, Ray, you've had 3 back surgeries.
Correct.
And all of those, you knew there was going to be a potential that you were going to need another surgery.
Correct.
And each time took the least disruptive surgery to get you back to your game, to get you back to running, knowing full well that there may be more surgery to come. And I think that's another really, really profound message for people to learn, is that it may take more than one surgery. And this may be a process that you will have to manage for the rest of your life. It may be your anatomy. It may be the type of activity that you do. It might take ongoing commitment to procedures that get you back out there. And that's okay.
That is correct.
That's okay.
That is right. When I had that first conversation with Dr. Schuler, my concern was, can I get back to running? But after I had the surgery and he said it went well, I said, well, what else can't I do? And he said, you can do anything. I said, can I ski? He said, yes. I said, can I swing a golf club? He said, yes. I said, you can get back to doing everything. Maybe everybody isn't that, that situation may be a little bit specific to me, but that was my situation. I couldn't stand up. I couldn't walk. And then I was able to be in a position where not only would I follow up with running all my best times at a very high level, but I was given the green light to do pretty much any activity that I wanted to do. Again, with the understanding that I do have to be careful. And I believe that I will make a prediction that in the future that I am probably going to be healthier than a lot of people who didn't have treatment, didn't get treated, because I've learned how to do the necessary steps to take care of myself, knowing my inherent weakness. So I learned that early so I can keep on top of it, and people that don't address it probably continue to deteriorate.
So education being so critical to understanding how to take care of your back, both for prevention and for ongoing care and ongoing treatment and ongoing maintenance of your body and of your back. So the education is critical. And at the Spine Health Foundation, that's our mission. Our mission is to educate Americans about treatments that work, about the right exercises to do, about how to, properly have your diet, your bone health, and making sure that we get these messages out to people that there are things that are in your hands that you can do, and there are treatments that are in the hands of very qualified, wonderful doctors all across the country who can take care of you and who can help you get back to your full life. And, we say we empower patients with knowledge and hope. When you know, then there is hope. When you know that you can get better, when you know that you can get back to what you want to do, there's hope. And that is why we think telling the Spinal Champion stories is so important. To be able to hear it from real patients and have a conversation, just an unscripted, conversation about what happened to you and how you got to where you are. For our Facebook viewers and our internet viewers, Ray is not only an accomplished athlete, he's an accomplished businessman. He's a small business owner. He runs PR Running Store. He's a co-owner of a fabulous retail store here in the Washington, D.C. metro area. And, there's a lot of movement involved in that. There's a lot of activity involved in running a business. And I don't think you can imagine not having gone through your life without proper care, having the right procedures, having the right medical team in place, and having the knowledge to know how to take care of yourself. Ray, I think it would be nice if we could tell our audience the importance. You had said to me that it was important for you to tell your story and to tell your Spinal Champion story. So if you could share that with the audience.
Sure. This being able to spread the knowledge about my situation makes me feel really good, really empowered, because I know there's so many people out there who are afraid and don't know what to do. In my retail job, I come across people all the time who come in and say, I hurt my back, I can't do X, Y, or Z anymore. And they don't realize when they're saying that to me that I am them before their treatment, and that I have had 3 separate procedures. And over the course of the last 23 years, there have been times when, I have been in pain and couldn't do X, Y, or Z, that I haven't been able to do things with my kids, that my wife knows I'm a bear when things aren't hurt. It makes my wife's life uncomfortable when I'm uncomfortable. Right. But I've had those opportunities to get proper treatment and get back in the swing of things. And each time that I've gone and addressed the problem with knowledge and to a place that has a history of being able to take care of back situations properly, I've come through with flying colors. And I believe that most people out there who are sitting there and just saying, woe is me, there's nothing I can do, don't have all the knowledge they need to understand that there is an option out there.
And they need to come to spinehealth.org.
They need to come to spinehealth.org, get information, talk to people who have been through it. There are lots of us out there now who are spinal champions, and we'll give you great feedback that will lower your anxiety enough that you can ask the questions you need to ask to get to the place where you can get the proper treatment, which isn't surgical always. Sometimes it is, sometimes it isn't, but there's so much that can be done to get you back and moving, and not saying to your kids, I can't do that with you, or friends, I can't go out and do that activity.
Right. Well, I think that to that point, one of the things that we are so excited about doing, and this is a big announcement coming up in 2020, we are so excited to announce that we are launching our podcast series beginning in January. And we will be telling our spine tales. And the spine tales were stories that were written every month in our journal in the past. And we're going to bring these stories to our podcast platform. And we're really excited to share that. So we've got our Spinal Champion stories through our spinehealth.org website. We'll have more Spinal Champion stories on our podcast. And we just want to use every medium out there that we have access to be able to tell our stories and to reach people and to let people know there are cures, there are treatments that work. Hear from others, contact other people, reach out to the foundation, join our community. And this year, for our end of the year, we've got an end of the year fundraising ask that we are asking people to consider giving to the Spine Health Foundation in your end of year giving, if you're so inclined. We're letting people know that it costs us about $55 per story to tell. That's our graphic design, that's our web media usage, and to put each story together it's only $55 to be able to do that. And so, we humbly ask that if you're considering giving this year, that you consider a gift of just, as little as $55 to help us tell these stories. It's really critical that people know where to go for help. They know where to go for unbiased information at the spinehealth.org website. They can hear from other spinal champions telling their story. And we have the nation's leading experts from all across the country talking to patients about various topics about your back. So you can go into our website, you can search for whatever topic you're looking for. You can find experts, you can find spinal champions, and starting in January, you can listen to our podcast. So I think with that, we're just about going to wrap up our conversation today. I want to really thank Ray for coming in today. He's a busy man, took time away from his store. I'm going to say hi to all the PR running people. I see you all logged in here, listening to our conversation today. Thank you for tuning in. And again, huge thanks to Ray for participating with us. I think Ray's a big believer in what we're doing. Ray's helped us think about the educational content that we're creating, making sure that we're answering questions that people want to know, and making sure that our content is relevant, easy to find, easily organized, and getting out to people. So with that, Ray, any closing comments?
Final comments. 1996, at the peak of my athletic career, I could not stand straight up. I could not walk. And since that time, after proper treatment, I have had such a full life, full of activity and helping other people be active and sharing my story. And all because I addressed my issues properly and didn't wait until it was too late to address them properly. So
don't wait till it's too late. That's right.
The knowledge to having the knowledge to move forward and taking those actions shouldn't be scary. Having that knowledge should be empowering so that you can make a change and live your life.
Fantastic. Thank you, Ray.
All right.
Thank you for sharing your story. Till next time.
All right. Thank you.
Alrighty.